Hello, Congressman.
How you doing, young lady?
Just fine. Do you have just a few minutes? I see you're on your way to the Capitol here.
Yes, I'm going to a meeting right now. What can I do for you today?
Well, you're sit on that health subcommittee of the Energy and Commerce Committee. Is that correct?
Yes, ma'am, I am.
Okay. Well, I want to talk to you about there's a House Bill 1666, that Patient-Centered Quality for Care for Life Act. Have you heard a little bit about that?
Tell me a little bit about it.
Well, there's a senator from Missouri, and he actually started this bill, and he's got about 22 sponsors now. And basically, they want to create a summit for healthcare for organizations like the CDC, HRQ, the CMS, to try to see if we can improve some of the quality of care for patients that have chronic conditions, patients with palliative care, with cancer, things like that. We obviously have identified we've got a disparity in the amount of education that we're giving our patients and the education that our nurses have that are caring for these patients.
Is this part of that Obama plan?
No, nothing to do with Obama.
There's a lot of pages in that.
There is.
I don't think anybody really understands what's in there.
Well, and I understand that, and there's a lot of things in this bill that I think are overlapping and have been brought up in other bills, but with this, really the workforce and the education and creation of this committee is really what it's all about, trying to improve that education, get grant funding for some of this education, so hopefully that's something that you can get behind and support when you go to your committee meeting.
How's this going to benefit you?
Well, as a nurse, we are involved in taking care of the patients with chronic health conditions, so we need a lot more education on how to communicate with families so they have more understanding of what's going on with their condition. In order to do that, we need some funding for faculty, for education, try to improve that workforce. And so that's kind of why we want this summit to come together, to come up with ideas of how we can do that the most cost-effective way.
Yeah, my poor old mama, she had a lot of belly problems, and so I know what you're talking about. I hope this would help that too.
Well, hopefully it will, because anytime a patient's in the hospital for a long period of time, they lack that education that we as nurses can give them. So hopefully you'll be able to support us in this, and hopefully creating of this summit, you'll be able to pass this through the House through your committee.
I like that old boy from Missouri, so yeah, I'd be glad to get behind this bill.
All right, well, I thank you very much. It was very nice to meet you.
Thank you, young lady, and good luck with your nursing.
Thank you.